Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, Nigeria witnesses a spike in confirmed cases of COVID-19, 70 in Lagos alone. Resident doctors raise alarm over hospital-to-hospital transmissions. And Ghana eases restriction after what it calls enhanced testing. Nigeria is witnessing a jump in the number of COVID-19 cases in the country. Over the weekend, Lagos alone had 70 new cases, while 7 was recorded in the Federal Capital Territory, 3 in Akwa Ibom and Katsina states, and 1 each in Borno, Bauchi, and Jigawa states. Let's take a look at a state-by-state breakdown of the cases, with Lagos now at 376, the FCT Abuja 88 cases, Kano's third highest with 36 cases, followed by Osun with 20, Oyo State has 16 cases, Edo 15, 12 in Ogun State, Kwara 9, Katsina 12, Bauchi 7, Kaduna 6, Akwa Ibom has 9 cases now, Delta has 4 cases, Ekiti and Ondo have 3 each, while Enugu Rivers and Niger each have 2 cases, with Benue and Anambra recording 1 cases each. More on that, the center is saying that overall 170 persons have been discharged, while 21 people have so far died. Now, many have talked about local transfer or community spread of COVID-19, but what appears to be alarming now is the possible hospital transmission, a situation that is getting doctors more worried. The president of the Nigeria Association of Resident Doctors, NARD, Dr. Sokomba Aliyu, who was a guest on our breakfast program, Sunrise Daily, today, said there are already cases of this model of transmission, calling on authorities to provide relevant gadgets for those on the front line in the fight against the COVID-19 pandemic.
At stand right now, we have not done adequately enough, so I'm not surprised that the figures are beginning to rise. The trend of the new cases is beginning to rise. At the outset of this outbreak, since this outbreak broke out about 9 weeks ago, so far, we have only tested about 7,000 people in Nigeria, and out of which we are recording about the 627 people that are testing positive to this disease. In about the same period, Ghana, our near neighbor, had tested about 60,000 people, and South Africa has tested about 108,000 people. And so the more people are tested, the more people will be identified, they will be isolated, and the spread of the disease will be contained. So from what we have on ground right now, it's obvious that we need to do more in testing people, and by so doing, we'll be able to identify more people, isolate them in good time, and prevent further spread of this disease, which as we speak right now, we are not yet there. So I think a lot more needs to be done with regards to testing of people that have this disease. Secondly, beyond the disease spreading in the community, which I believe we are all aware of, the disease is already at the community level, we are beginning to have a situation where this disease is now going to be spreading in the hospitals. We're going to be having hospital transmission of this disease, which is going to be a very serious condition, because unlike what is obtainable in communities where one patient can just spread it to 2 to 3 people, if we are having hospital transmission of this disease, we will have a situation where one healthcare worker, a nurse or a doctor, will be spreading this disease to as much as 50 to 100 other patients who probably have come to the hospital to seek care for their regular ailments. And this is already happening in Nigeria, so I'm not surprised.
Joining us for more on the rise in cases and government interventions and also the happenings in the United Kingdom is Dr. Essien Ukorobi, is a GP and emergency frontline staff on COVID-19, NHS England. Thank you for joining us at this time. Before we come to Nigeria and the situation here in the UK, are we over the peak or witnessing a downward trend in the number of cases there in England?
Thank you very much, Millicent. Currently in the UK, we are experiencing what I believe is a downward trend in terms of the number of deaths as well as the number of new infections in the UK. So yesterday in the UK, we had about 596 deaths in the UK, and that's a significant drop in the numbers that we had last week this time. So last week we had about 900 people die in the UK, which was one of the highest numbers recorded here in the UK, and it continued to reduce steadily. And yesterday we had just below 600 people die, and we've also seen the number of new infections also reduce significantly, and it shows that we are experiencing a downward trend at the moment, which is very good.
Perhaps in Nigeria, when you compare both cases, one would say, you know, the gap is still there. But when you look at the weekend cases of states, especially Lagos, recording as much as 70, we're witnessing a jump in that. Do you suspect that the more testing is resulting to the more COVID-19 cases, confirmed cases in the country?
Yeah, I believe the more testing is resulting into more COVID-19 cases in the country. And currently, the numbers that we have in Nigeria is not a true reflection of the current situation of the pandemic in the country. At the moment, we have 627 cases of COVID-19 in Nigeria, and we've tested just above 7,000 people. That's just about 10% of all tested cases have come back as being positive. And that means 1 in 10 people have tested positive for COVID-19 in Nigeria in a population of about 200 million. So I think one significant thing that the government should focus on, which is also WHO's guideline, is testing. We can't test 8,000 people in a population of 200 million and expect to get any kind of trend. In the UK here, at the moment, we are testing about 21,000 people every day. And the plan at the end of the month is to test 100,000 people per day. This way, you can get a trend in the virus. You can know how the virus has spread and the areas that are, you know, the new hotspots of the virus. At this moment in Nigeria, we know that Lagos is the hotspot. And yes, more work needs to be done in Lagos. But apart from the 22 states that have confirmed cases, what is the government doing as regarding to other states that have no cases yet? There might be cases there, but testings have not been done, and we can't know if there are coronavirus patients in those places. So yeah, more testing needs to be done in order to get a trend of the virus and help the country combat with this virus, really.
So a lot more work for the NCDC and Presidential Task Force. But the Doctors Association in Nigeria are also worried about a possible trend in hospital transmissions. Has the UK witnessed this, and what was done to curb it, and what measures do you think we need to take to prevent the frontline workers to protecting themselves if we know that COVID-19 presents itself sometimes as asymptomatic?
Right. Currently in the UK, everyone who has come into hospital with a temperature and a new continuous cough is treated as COVID-19 until proven otherwise. So there is a fantastic triage system where those patients who come with a temperature and a new continuous cough are being triaged and they are seen differently from other patients in order to reduce the risk of spreading this virus from one patient to another. Also, it's important and more important for Nigerian doctors as well, to have the appropriate protective equipment, because this would reduce the transmission of the virus from the patient to the doctor and from the doctor to another patient who is negative. So it's important that the government scales up the personal protective equipment for the doctors so that they can confidently look after the patients and also reduce the risk of transmission. And also, I think most hospitals in Nigeria should begin the triage system and to look at every possible case of fever and a new continuous cough as a possible COVID-19 case until proven otherwise.
Tell us about, there are a number of new cases around the world, and the a number of people are also getting discharged, and that also is happening in Nigeria. Many people are questioning perhaps the treatment model, because we're also recording a number of deaths, even though we've been told that a number of them, ages 50 to 60, thereabout, have had underlying causes. What are your thoughts to the treatment of COVID-19 in Nigeria and the UK?
Well, as we all know, at this point, there is no specific vaccine or treatment modality for coronavirus. The mainstay of treatment, I would say, for the virus is symptomatic management. So if people have got temperature, we try to manage the temperature. If they are breathless, they would require oxygen. And if they have significant lung infection, then, in worst case scenarios, they might require ventilators. In the United Kingdom, we treat the same way basically as other parts of the world, controlling the temperature, treating the infections with antibiotics. If there is evidence of bacterial impositioning, we also ventilate those who need ventilations. So in Nigeria, I think we should focus on increasing our capacity in terms of oxygen provision in the hospitals, because that's a vital part of the treatment of COVID-19. Because when we see a surge in these cases in Nigeria, then a lot of demand will be placed on the health facilities to provide oxygens, because without oxygens, the lungs will not, function properly in these very severe cases. And unfortunately, we can see quite a lot of people die because of things like lack of oxygen, things like lack of ventilators in the country. In the United Kingdom at this point, the country has a target to get about 30,000 ventilators, which, they are gradually getting up to. I think Nigeria should also consider scaling up its hospital beds, scaling up the oxygen supply to the hospital, as well as scaling up the number of ventilators that are in the country at the moment. Good enough, we have just 21. People have died. That's sad enough, but that's still a low number compared to the United Kingdom that has had 16,000 people, died, unfortunately, over the last couple of weeks, and owing to the kind of health system they have. So there is a scare that if these cases multiplies in Nigeria, then it might be really, really challenging if the health sector is not adequately prepared. So this is the time, for contingency plans to be set up, in the health sector, should this number triple or double in the coming weeks or months ahead.
Finally, and very briefly, going back to the history of the virus, what can you tell us about what many have referred to that this virus has been talked about in books and movies before the outbreak started in Wuhan in December?
What we know from what the World Health Organization has come up with is that, this virus started in the Wuhan province in China, in one of the wet markets where, wet meats are sold. And from these animals, they get transmitted to human beings, and through eating or coming in contact with these animals. And then onwards, they are transmitted via respiratory droplets from one person to another. So what we know is that it's come really from Wuhan in China and from their wet market, against other speculations that we have been hearing on media that it's from 5G or from a lab or things like that. I think it's rather from the wet market, and it's from the animals transferred to humans.
All right, Dr. Estienne Ukure, BGP, Emergency Frontline Staff and COVID-19, NHS England. Thank you for joining us at this time.
Thank you very much, Millicent.
Stay safe. Still to come on the COVID-19 update, we have more on the pandemic when we return. Welcome back. It's determination and more measures in place. States across Nigeria trying to prevent the spread of the COVID-19 pandemic. We begin in Cross River State, where the government is disbursing the monthly payment of 30,000 naira stipends to beneficiaries of the Youth Employment and Social Support Operation, YESO, in collaboration with the World Bank in Akampa local government area. to ease the challenge of the partial lockdown in line with the COVID-19 pandemic stay-at-home order. Speaking in Akampa, the Commissioner for International Development Corporation, Dr. Inyang Ashibong, who flagged off the exercise, said the aim is to assist the vulnerable during this period of the pandemic to meet their needs. Over to Kano, where the state governor, Abdullahi Ganduje, has signed into law the state's Public Health Infectious Diseases Regulation Law 2020 amidst increasing confirmed cases of COVID-19 in the state. Backed by the state's public health law, the new regulation empowers the governor to take any action necessary to prevent the spread of any infectious diseases across the state. In the meantime, under the regulation, the governor is set to evacuate Almajiris who are not indigents of Kano State. Over to Borno State, where MSF, Medicines Sans Frontiers, is mourning its staff who died of COVID-19 on Sunday in Maiduguri. He is the index case in Borno State. MSF head of mission Nigeria, Mr. Sahim Hajjad, confirmed the death in a statement made available to journalists earlier today. According to the statement, MSF is now supporting the Ministry of Health in contact tracing, adding that projects will continue to operate, providing essential treatment for communities in Nigeria. The late MSF staff was working in Polka, a district in Gwoza local government area of the state, and it's a place that houses thousands of displaced persons. And in Lagos State, the governor expressed optimism in the success being recorded in the battle against COVID-19 infection as he announced 4 more persons, all male, discharged to reunite with their families and the community. The patients, 3 from the mainland infectious disease hospital Yaba and 1 from the Lagos University Teaching Hospital Luth, are said to be fully recovered after testing negative twice to COVID-19. This brings the number of patients discharged from the Lagos facilities to 98. Let's take you to Ebonyi State, where the government is to carry out aggressive COVID-19 tests on over 2,000 indigents of the state within the next 2 weeks. The state governor, Mr. Dave Umahi, while addressing newsmen at the government house in Abakaliki, the state capital, said the free COVID-19 tests powered by the state government will take off from the ward level. He added that the government has now made it compulsory for indigents to wear face masks when moving around within the state at the allowable time, and they have started the distribution of over 160,000 pieces of face masks to citizens at marketplaces, rice mills, health institutions, and other people on essential duties. The bride-to-be of popular musician Davido Adeleke, otherwise known as Davido, has tested negative to the coronavirus disease. The musician, who made this known via his Twitter handle, Chioma, said, or rather had reportedly tested positive to COVID-19 after getting back into Nigeria with Davido and his band after a trip that was cancelled due to the virus outbreak in the US. Announcing the news on Sunday, Davido thanked all for their prayers. And now Dr. Angela Emechebe, a public health physician, joins us for more on the pandemic via Skype. We'd like to thank you for joining us at this time. We're seeing a higher number of cases in Nigeria, and this is in spite of the lockdown in the major cities, Lagos, the FCT, Ogun State, and to a large extent, Kano. Do you think we're social distancing enough, or it's a problem of people not staying at home?
I think the problem is, good afternoon, thanks for having me. I think the major problem we have is that people are not really adhering to this lockdown. And when they don't adhere to the lockdown, they move around, the community transmission still continues, and even the social distancing, because in the very poor areas of Lagos, where you would have 10 people living in a room, it will be a bit difficult for them to maintain social distancing. But we would always advise that they should wash their hands properly with water, even if they are living in deplorable conditions. So I feel that what is making the numbers go up is because people are not really adhering to the lockdown.
Let's finally look at what happened over the weekend. The viral video of a person who supposedly disposed the PPE, personal equipment on the road. Some have said that perhaps that is the attitude of a number of people in Nigeria as to COVID-19, and perhaps this is fueling community transfer and the varying transmission levels in the country.
Absolutely correct. Even though there's not been any law guiding Lagos State or guiding Nigeria over the release of corpses or holding back corpses when they die from COVID-19. So in that case, that corpse was released. A lot of lawmakers went for that funeral, which on Sunday, they tendered an apology and, said everybody would be tested. Leaving the mask or the hazmat suit that the guy wore on the floor would also increase this community transmission. And I'll employ and plead with Nigerians, because the belief out there is that there's no COVID-19. I've equally had some discussions with security officials around my area, and some of them believe, oh, there's no COVID-19, Nigerians were immune to it. We are not immune to this. If we do the right thing, if we respect the law, keep to the law, and do the proper thing, we would be able to contain this virus.
All right, Dr. Angela Emechebe, thank you so much for joining us at this time. Continue to stay safe.
Thank you.
Well, Ghana's President Nana Akufo-Addo has lifted lockdown restrictions on 2 major regions in the country, citing improved testing of the coronavirus pandemic across the West African country. Ghana, which has recorded over 1,000 cases, exactly 1,042 cases and 9 deaths, is the first African country to not extend but lift a lockdown. Meanwhile, several European countries are also starting off the new week with tentative steps to easing the strict lockdowns in place, though officials insist the outbreak is far from over. Nigeria Center for Disease Control, NCDC, says to remember face masks are to be worn with a combination of social distancing, hand washing, cleaning of surfaces regularly. The website has all the information you need and advisories, also statistics on the cases across states. You can also access emergency contacts. Also, the World Health Organization's website has rolling updates on the pandemic, the body's strategies and plans on the coronavirus. That's our update at this time. We're back again at 6 p.m. Continue to watch Channels Television, your home for the news. I'm Millicent Walker. Bye for now.